remember that. And oh yes, do come in. Yes, just position yourself right in front of me here. Oh my. Did you choose those shoes yourself? You did. No, I don't need to know where you bought them from. I suppose we shall have to focus quite a lot on the eye portion of the test. Yes. So, firstly, don't be alarmed. I know you're probably not used to, well, how do I put it, the class that I'm going to be presenting to you today. No, I'm not your usual type of doctor. Possibly because I'm not a doctor at all. Yes, that is quite alarming, isn't it? Why am I doing this exam? Firstly, don't, I can feel you backing away. Don't do that. What's the best way for me to explain this? Well, I come here rather a lot. You see, I know it probably doesn't look like it, but I've had rather a lot of facial surgery, amongst other surgeries, of course. And I do like to come before every new procedure to just see if my facial nerves are still working. It really is quite a surprise every time when they say they really are working. Anyway, I'm so used to this exam that I feel like I've become a bit of a pro. Yes. Well, no, so I'm getting to that. Impatience. Right, so, because I come so often, I normally have the same doctor, who I presume you may have seen before, Dr. Calm. Yes, quite a delightful girl, but bless her, she does need a little bit done, doesn't she? So, what I offered last time I came in was in exchange for letting me have a little go at this, because I've always fancied a little bit of being a doctor, mainly because, you know, I could give people advice on what to do, and I do like to have my say. But in exchange for letting me have just one session, I will give her a free makeover consultation. Yes, well, it's probably not very ethical or legal. No. You are in perfectly safe hands, and Dr. Calm has left me a full list listing every single thing that I need to include. Okay, so she will also review your results, and if anything seems a little bit strange, then she will call you back. Okay? Yes, well, actually, by having me do the exam today, you won't have to pay. No, so you can actually save your pennies, and perhaps, may I just suggest off the top of my head, going out and buying some new shoes with what you saved. Yes. So, let's get the admin out the way. I normally have someone else to do that for me, but never mind. Okay. So, would you just confirm your first name for me, please? Right, lovely. And your last name. Good. Okay, I am trying to be a little bit more polite and professional today, so I shan't make any comments on that name. So, your date of birth, please. Oh, bless you. Yes, quite young still, aren't you? Yes, but the collagen is starting to lose its elasticity on your face, isn't it? No, it's just a general observation, yes. The collagen levels start to drop around the mid-20s. Yes. Anyway, right, so name, date of birth. Now would you like your results emailed to you? You would. Could I take an email address then? Lovely. Right. How quaint, using some sort of pun as an email address. Lovely. And could I take your address as well, please? Lovely. It will just be used to send out reminders to you, okay, and just notifications of the latest procedures we have going on. Okay, so first line. Lovely. And yes, I actually know the location of that. I do tend to ask my driver to go the other way, to be honest with you. Okay, now this is just a little bit about just your medical history. Okay, so are you on any long-term medication? Right, not even for eyesight? No, okay. Right, no long-term medication. Good. And have you had any surgeries at all within the past 18 months? No. Good. Do you wear glasses or contact lenses? Good. Okay, and do you have any signs of dizziness today? Any sickness? No. Okay, so you feel quite well today, would you say? Out of 10, how do you feel? Good. It's always a good idea to feel quite, bright and healthy when you come to have these things done, I feel. Yes. Right. Lovely. I just got to fill in a couple of these tick boxes here. Patient seems within relatively sound mind. Good. Okay. Do you have any allergies at all? No. Have you had any trouble with hearing loss at all? Okay. And what about your taste? Any loss of taste at all? Right. I can't imagine you dine in particularly fine restaurants where the taste is exquisite anyway. Good. That is everything today then. Finally, I just need you to let me know that you definitely consent to me conducting this examination. Well, I'm not going to write with regret, but let's just tick that box. Lovely. Well, now we can get started. How exciting. So, I've been told that I could wear these gloves. I will be honest with you. They're not exactly fashionable, are they? No, I don't really like the feel of them either, you see, and I do like to let my nails breathe. Yes, let's see, I do have a slight issue though in the fact that I do really need to protect my hands because I don't tend to let them touch the general public unless their net worth is higher than my New York apartment. But anyway, I know. Lovely, lovely, lovely. What we have here. Yes, some antibacterial hand gel. It's much better. Kills 99% of bacteria. Lovely. In fact, would you just like to put some of this on? Oh, you did the little pump as you came in. Fair enough. No, I shall put some of this on now. Okay. Lovely. Yes, really work it into those hands. Okay. ready to, unfortunately, touch that face. So, I imagine, as I know you have been to us, was it a couple of years ago you came, I saw on the records? Yes. So, you are aware of what a cranial nerve examination is? Good, yes, it just is going to check all of the nerves that's supplied for that interesting face. Okay. If at any point during the examination you would like to stop or have a little refreshment, just let me know, darling. Okay, so we're going to begin with the olfactory nerve, which is, correct, the sense of smell. So you said that you hadn't had any issues. Okay, so this should be fairly simple. All I'm going to do, darling, is I'm going to use some little essential oils here, and I'm just going to apply them to a little cotton pad, and I'm going to ask you just to identify them for me. So nice and easy, even you should be able to understand that. Right, okay, let's see. Okay, so are you ready? Okay, and your little whiff, and if you would just like to tell me what you think that is. Coffee, that is correct, well done. Okay, let's try another one, shall we? Okay, right, let's put this up to those oversized nostrils. And that one, darling. Cinnamon, well done, well done. Okay, we are on a roll here, aren't we? Let's see if we can make it a full house. I just have a couple more for you. And darling, I do apologise about the bird noise. Yes, frightfully common, I feel. I mean, I don't mind it, but it does rather go on, doesn't it? Yes, I asked Dr. Calm last time I saw her to actually move the office, but apparently that wasn't a good use of hospital funds. Yes, I couldn't really understand that. I mean, clearly my annoyance should be a priority, but anyway, so just try to focus. Okay, and what do you think that one is? Lavender, very good, very good. Okay, now I lost track. What did I say? Did I say we have one more left or two more left? I really can't remember. Let's just do one more anyway, we seem to be doing quite well, and I'm getting quite bored, to be honest with you. Right, okay. Good. Okay, nose at the ready. And could you identify that one for me? Lemon? Yes, it is lemon. Well done. Good darling. At least you have a first-class nose, that's something. So let me make a note of that. Right. Okay, so olfactory nerve. You passed. That all appears to be working correctly. Patient didn't seem to have any trouble identifying the smell, so well done. Now I'll give you the choice of what you would like to do next. You can either do the optic nerve, the eyes, darling, or you can do the trigeminal nerve. Yes, that's the touch. Yes, that's a touch, I believe. Oh no, that's clenching teeth. Oh, it's clenching teeth and touching, darling, with some mixture of Wonderful delights. So, which would you like to do first? The optic nerve. Wonderful. Okay. So, we can delay me touching your face a little bit longer. Joy. So, darling, you mentioned you don't wear glasses. Lovely. If you wouldn't mind, could you just step behind? You can see that little line on the floor. Fabulous. It saves me moving backwards. Now, what I'm going to ask you to do is to simply read from this. Okay? Are you familiar with one of these? You are. Wonderful. And when was the last time you had an eye test? Not too long ago. Okay, wonderful. Do you remember how far you got on this? Oh, it was quite low down. Okay, fabulous. So just stand behind the line. Wonderful. And again, if you could just cover one eye, then we'll do this, and then simply we'll do the reverse. Is that okay? Wonderful. Let me get a little pointer pen. Okay. Okay, are we ready, darling? Good. Okay, let's start at the top. Lovely. Good. There is no rush, darling, although I must say it's been at least an hour since I've had a glass of champers, so just keep that in mind. Yes, good. And the next line, please. Lovely. And this line just here. Good. And moving down to here for me, please. So. Lovely. And can you make out any of this row? Oh, fabulous, darling. You're doing very well, I must say. And any of this row? This one? Yes, no, that's good. What about this one? Okay, we'll stop there. Okay. And now, darling, if you could do the other eye. Fabulous. Okay, so when you are ready, starting at the top again. Good. Excuse me. Yes. Good. You're quite used to this, aren't you? I don't really have to bother with the pen. It is quite tiresome. Now, where do we get to? Oh, here. Yes. No, I'm concentrating. Sorry, darling. I tend to lose interest during these things, you know. Good, and the next line for me. Lovely. Let's move on down. Good, and let's see if you can get any further on this line. Oh, fabulous, darling. Can you do this one? Lovely. Can you do any of this row at all? No. Okay, fabulous, darling. So, I suppose my doctor diagnosis there would be you do have very good vision. You do. So what will that put your vision down to? I don't really understand these numbers on the side, darling, so I'm just going to put down A-star vision. Okay, I feel that sort of gets it, doesn't it, really? Don't need any fancy talk. So, right, where's the bit about optic nerve? Here we go. Yes, so past the, what are those called? You know, those child things. You don't know. What do I feel like they're called? Smelling, schmeelen? I have no idea, darling. Let's just write down chart. Good chart readings. Yes, that's enough information. Now, there were a couple of other eye tests, but Can I be bothered to do them? Well, I suppose we could just do sort of a little one like this. I've had this done to me before. So I think what you're supposed to do, darling, is follow my fingers. Yes, I think that's the thing, isn't it? We're going to make it a thing. So, if you just focus on my finger, darling. Okay, I'm just going to be sort of concentrating to see if you pick it up. Yes, I think that does something. So, follow my finger. No, I am concentrating, darling. No, don't worry, I can totally see you there. I'm just trying to read the time. Yeah, oh, it's nearly time for my lunch. Yes. What am I having, darling? Oh, how kind of you to ask. Yes, well, I am actually on a liquid diet, so today's diet, I believe, is liquefied llama lung. Yes, it's an ancient recipe, apparently. It's meant to speed up your metabolism and therefore promote fat loss. Yes, I do really want to start to be able to feel my bones. Do you know what I mean? Then you really know that you've lost enough fat. So I'm quite looking forward to that. No, darling. No, we don't drink tea, darling. No, well, unless it's served to us, of course. I couldn't make my own. No, champagne, darling. I'll be having it with. Yes. It's quite unusual. I don't know if I say it's unusual. It's sort of just something I suppose people of my kind are more used to. You know, I suppose you're more used to sort of soup, aren't you? Soup and rolls. Yes. Right. I presume that was fine. You appear to be following my finger properly, so let's just assume those little eyes of yours work. Yes, and they are quite little, aren't they? Yes, like piss holes in the snow. Bless. So, darling, for eyesight, I'm just going to write. Good. Yes, doesn't appear to have any issues, so we'll leave it at that. So, the next nerve, we'll go with trigeminal. It could be trigeminal, I really don't know. So, this is to do with touch. Okay, so just to check, I suppose that you'll respond really to me touching areas of your face. So, for this, darling, I presume I'd use some sort of cotton, would you think? Yes, I can never quite remember. I'll be honest with you, I normally turn up to these things a little bit hungover. Yes. Anyway, you don't need to know that, do you? Okay, so, let's have this little bit. Oof. So, darling, I'm going to need you to just close your eyes. Yes? Good. Close your eyes. And what I'm going to do is I'm going to touch certain areas of your face. And I just want you, A, to identify what area of the face I'm touching. And B, if you just tell me if you feel any pain, any sort of tingling sensation. Okay? Is that alright? Wonderful. So, let's close those eyes. Lovely. So, what's the area, please? Good. And any pain, darling? Good. Let's touch here. No pain? Good, that was the right area there. Wonderful. And what about here? Lovely. And here. Good. Yes, sorry, darling. I must admit that I am actually not quite with it today. Probably not something you want to hear, but yes, I did just have my flu jab. Yes, it makes me feel a little bit dizzy, I must admit, but to be honest with you, I had to have it done because I'm travelling next week. Yes, and you know how it is when you're mixing with these common folk at the airport. You really do need to protect yourself from germs, so needs must. But yes, I'm feeling a little bit drowsy, so anyway, right. Yes, good. And any tingling? Okay. And let's try here. Good. And we'll just do one more area because I'm losing the will to live. Lovely. Okay, darling, if you'd just like to open your eyes. Fabulous. Quite a delightful sight to see when you open your eyes, I would imagine. Right, so in that case you were able to identify all the areas on your face. Fabulous. And you didn't experience any pain or any changes in sensation. Wonderful. So, darling, the next thing I'd like you to do is simply could just clench your teeth together for me. This is just for me to observe. Oh my. No, unclench them. No, the muscles are working fine. That wasn't quite why I was so shocked. When was the last time you went to the dentist, darling? Right, and where are your dentists? No, I'm not familiar with that street. No, mine are done on Harley Street, obviously. Right, so you don't have a cosmetic dentist. Right. There is some discoloration. Are you aware of that? You don't really mind it? What about the people viewing you? You think they should love you for what's on the inside? How naive. Okay, so moving on. The teeth, fine. Well, not fine, but the muscles anyway. Now, what it says, move your jaw from side to side. Can you do that for me, darling? Yes, like that. Right, this is quite a frightening sight, isn't it? A little bit of clicking, I noticed. Let's have a little... Yes, do it again. Yes, if you ever had a chiropractic adjustment done on your neck and shoulders. No, it's just sometimes, darling, that can cause a little bit. Can you do it again for me? Yes, tell me, do you have them kind of work that area massages at your weekly masseuse? You don't have a masseur. But darling, how do you relax at the end of every week? You must go for your spa or have your masseuse come to you. Oh my. No, sorry, darling, I just felt a little bit lightheaded. What do you mean you've never been to a spa, darling? Okay, what about a health club, darling? You're not a member of any health clubs. Country clubs? Oh dear. Oh, you poor thing. Well, I won't go on about it any longer, but bless you, no, I was going to recommend, obviously, getting that area massage, but perhaps just going to see your chiropractor would be wise. You don't know what a chiropractor is. Well, maybe Google it. Yes, if you know how to use a computer. So, darling, that's all of the trigeminal will go with nerve done. So now is just the facial nerves. Okay, so first things first, this is all about resistance, darling. So I'm going to ask you to perform a series of tasks, fairly simple, even you can understand. And I'm just going to ask you to resist. Okay, so I need you to raise those, well, I was going to call them eyebrows, but I mean, I'm not sure they quite meet the definition. But I'm going to ask you to raise them, and simply I'm going to try to unraise them. Yes? Okay, so let's try that now. Yes, very good. Try to push them down, you try and raise them up. Right. Good. Now I need you to close your eyes, and I'm going to try and raise the eyelids up. Okay, so let's have a go. Yes, not bad. And now, what does that say? Yes, below cheeks. Ooh, unsavoury. Yes, could you just basically blow your cheeks out like a pufferfish? Yes, there's not really much difference in the size of your face if you do that, is there? Right, so nice and puffy. Lovely. And I'm just going to try and squish them. Okay. Lovely. Resist, resist, resist. It's probably the first time you've had someone of my class touch you, I imagine. Bet you weren't expecting that extra bonus today. Okay, wonderful. And we just have one more to go. Smiling. So it's time to see those delightful gnashes again. Simply smile for me, your very best smile, darling. I know, just do your best, okay? And I'm just trying to close that smile, okay? Just turn it into a frown. Alright, and, well, to be honest with you, it's quite unfortunate as we don't need to add to those frown lines, do we? No. Anyway, let's, try that now. Good. Lovely. Well, let me just use my gel again. I won't lie to you, darling. Some lip balm or moisturiser on those lips wouldn't hurt. Okay. So, let's see how we're doing. How much longer? Not too much longer, darling. No, we're having fun though, aren't we? Yes, me and you. You're not having fun. Well, I'm having fun. You think I've been quite rude? Darling, I'm just being honest with you. Surely you appreciate honesty. Right. You'd rather I was just nice. Well, let's just get through this exam, shall we? Right, the vestibulocochlear nerve I'm going to go with. I can't really be bothered to learn if that's the right pronunciation or not. This is going to test your hearing, darling. So, I'm going to whisper some numbers. And simply all I need you to do is to repeat them back to me. So, if I could ask you to trot those little trotters behind the line again. Yes, the second line this time, actually. Wonderful. And can you see me nice and clearly? Well, no, I know it's a hearing test, but I was just asking. So you can see me okay. Fabulous. Okay, darling, you ready to hear some numbers? Wonderful. Okay, now I'm actually just going to cover my mouth for this. Yes, a bit of mystery, I know. Just so that you can't lip read. Okay, so 1. Good. That's nice and easy, wasn't it? Okay. 5. Lovely. And 27. Good. 56. Well done. 82. Good. And we'll just do a couple more for you, darling. 33. And lastly, 119. Lovely, darling. Can you bring yourself back to me? Wonderful. Okay, darling, I think we're almost done. Yes. Right. Let me just double check there, because honestly, let's see, we've done the facial nerve, yes. Oh yes, I suppose I better, what's this? Check your tongue. Ooh, how unpleasant. Right, well, I suppose I should, that's the glossopharyngeal and the vagus nerves can be assessed together. How lovely. So, right, for the first one, it says, I need you to cough for me. Right, God, I don't have a mask. Right, okay, I'm just going to ask you to cough, okay? I'm just going to cover my mouth. Right, lovely, it's just part the germs. Right, yes, that was just check apparently that the inside of the mouth was working or something like that, I don't really know. Right, next, ask the patient to open the mouth wide and say ah, using a tongue depressor. Yes, okay, let's see, I suppose this could be used as a tongue depressor. I mean, I can't really be bothered to find the real equipment, so, darling, if I could just get you to say ah for me. Lovely. Use that term lightly. Good, okay. No, that's good. So you've passed those tests. Your throat also doesn't look inflamed or anything, so that's good. Now, what is this? The accessory nerve. Honestly, Dr. Calm appears to have left rather a lot of notes for me. The accessory nerve is a purely motor branch to the trapezius and the sternocleidomastoid muscles. Oh dear. Right. The sterno, we'll just call it, can be assessed by asking the patient to turn their head to each side against the examiner's resistance. Do I want to do that? What's the next one? Trapezius can be assessed by asking patients to shrug their shoulders. Right, well, let's just do the shrugging shoulder one, shall we, darling? Yes, apparently I've been quite rude to you, so imagine you want to go. So, if you could just try to raise your shoulders up, and I will try to depress them. Lovely, quite meaty shoulders, aren't they? Yes. Good, so, yes, that nerve is fine. Lovely. What else have we got? The last one. The hypoglossal nerve. Ask them to expect the tongue. Well, I sort of did that, didn't I? Ask the patient to protrude the tongue and move from side to side. We are certainly not doing that because that would be terribly common, wouldn't it? We don't stick out our tongues. No. Okay, darling. I think we're done. How fabulous. Let's review your results. So, your olfactory nerve, sense of smell, was absolutely fine. The optic nerve, again, fine. Trigeminal nerve, good. All the facial nerves, the resistance, very good. Vestibulocochlear nerve, the hearing was fine. And then we did the accessory nerve and the glossal nerve. Lovely. Good, darling. I think we're all done. Do you have any questions for me? Will I be working with any other patients? Why'd you ask, darling? Well, look who's being honest now. I'm quite proud. Well, darling, your results will be emailed to you. Yes. Now, I can't see any causes for concern, so I doubt that Dr. Khan will be back in touch, but she may just follow up with a phone call or something. Yes. She'll probably ask about your experience here. Is there anything I can do to... Oh, I don't know. Perhaps you would say that I was a wonderful doctor? Do I need to fetch my purse? No. Oh, right. Well then, what a delight that I shan't be seeing you again. Yes. Well, I'll let you go, darling. Yes, it's lunch o'clock anyway. Or should I say llama o'clock, probably. So I'll let you go. Yes. Yes, well, I can't really bother, darling. My throat is actually drying up, to be honest with you. I told you it's been at least an hour since the champagne and starting to feel it. So if you wouldn't mind just running along. Fabulous. Wonderful. Enjoy your mundane day. Bye-bye now. Right, patient 20791. Just have to email the results. I mean, I really can't be bothered to do that myself. I'll try and get one of the girls outside to do that. Right. Off for my llama lunch. Yum.